All right, welcome back, everyone. We're going to continue with our material for reproductive system as far as where we left off. So let's go ahead and try to get to where we were. We've just been progressing with more of the female reproductive content as far as in our recent material. So just a little bit more of that as far as content is concerned. Let me just close out some of this stuff for us. Okay. So like we said, we discussed about the ovaries, the fallopian tubes, the uterus. We're talking about the walls and the regions of the uterus. We discussed the vagina or the birth canal, the method in which the eggs are made called oogenesis. And then finally, we were discussing the menstrual cycle. We were discussing just how this whole process works as far as the endometrium shedding. It was a bellwether question that I had asked as far as when the endometrium sloughs or removes itself. The sloughing process is just a more technical term for it. That's called menses. As far as in the whole uterine cycle. Okay, then we discuss a little bit more about the hormones that are secreted. So estrogen and progesterone, these are the hormones that play a major role in the female reproductive system, just to name a few. And then finally, we started moving forward relating to the different names of this newly fertilized egg and its developmental cycle. So for instance, we mentioned how when the egg and the sperm fuse, we officially call it the zygote. It has combined its chromosomal count to become diploid. It is now 46 chromosomes or 23 pairs. Then as it develops further, we mentioned how we have the embryonic stage, which typically lasts until the 9th week, so roughly the first trimester. Remember, human pregnancies are 3 trimesters. Then within that embryonic stage, there's like a subcategory which we call the blastocyst. It's when when the female body starts to secrete specific hormones like HCG, human chorionic gonadotropin. And the whole idea here is that HCG is a guaranteed way to prove if the mother is, or the woman in this case, is pregnant. Because as I mentioned, sometimes with the pregnancy tests that people take, as far as testing the protein in urine, that's not always a guarantee. It can sometimes be a false positive. All right. So overall, we have a good understanding of what's going on. We mentioned how it has to move its way into the uterus, eventually forming the amnion and the umbilical cord, or the predecessors to that. Okay. So I think we were here as far as the placenta is concerned. We were mentioning how it's a barrier between the mother and embryo, so that blood doesn't directly exchange. It instead delivers the nutrients and oxygen, which is obviously necessary for the baby, or the developing baby to get. Also, we mentioned how the placenta does become a endocrine organ in women after because the ovaries are not functioning during the pregnancy. It makes sense. There's no more eggs that need to be released when there is an egg already fertilized and growing. So again, pretty straightforward stuff. All right. Now we're officially in a more complex structure as far as our development. Now we're officially referring to it as the fetus. So this is technically in the 2nd trimester when we officially start calling it a fetus, or in the fetal stage, so the beginning of the 9th week. So end of 1st trimester, beginning of 2nd trimester. All organ systems are formed by the end of the 8th week. So by the end of the 8th week, you've officially created all the organ systems. They're obviously still developing, but their concepts are still there. Activities of the fetus are growth and organ specialization. So you're really growing those organs and growing the tissue and specializing those organs. It is a stage of tremendous growth and a change in appearance. That's something key. So let me see if I can show you guys something that I like to show in class. Fetus animal comparison. There we go. This is a pretty standard image that I like to show from time to time in class, just because it really astounds me. There we go. This one. It really astounds me just what's going on when it comes down to how we look in our stages of development. So, for instance, obviously, upon fertilization, you're not really going to be able to, you're not going to be really able to notice anything, truth be told. It's just the sperm and the egg fusing. The only one that looks slightly different, I guess, is like this little chicken cell, but it's still a cell. Then when we have that embryonic stage, right? We're starting to develop. If you look at the earliest structure, fish, turtle, chicken, pig, human, not a lot of differences, right? We look very, very similar. And a lot of this plays into the whole idea that genetically speaking, we're not that far off even from mosquitoes. Now, obviously, we're very complex creatures compared to mosquitoes and a lot of other animals for that matter. But if you had to look at our chromosomal count and what we share with these other animals, there's a lot in common. Now, as this starts to develop a little bit further, right, you'll see that we start to see some differences. As you start to reach the second and into the third trimester, yeah, you can start to notice some key distinct differences. First and foremost, even in the second trimester, a fish starts to become very obvious, right? It starts to look a little bit more like what you'd expect like a tadpole to look like. Turtles, chickens start to have a little bit more distinct structures, but even then, you have these creatures that are different than us by quite a bit and looking rather substantially different. The only animal that's still going to look really close to us is a pig, and it's mainly because pigs are mammals, right? Then as you reach the third trimester, you really start to get more development into what you'd expect to see as far as the creature, and then obviously in its adult form, we know what we look like, right? But I do find this very interesting that in the earliest stages, it is almost impossible. There are some key differences, obviously, for the trained eye to see, but in the earliest stages, it's just we all look very similar, regardless of our animals and our species. So let's go back to where we were. All right, so the effects of pregnancy on the mother. So this is important to discuss as well, so we have a good understanding of just exactly what happens to the female body while all this is going on. So first off, pregnancy, of course, is the period from conception until birth. Again, the average pregnancy in humans is about 9 months. So it's going to be 3 trimesters. Overall, the idea is that there are instances where sometimes a child is born early, premature, as I call. There are instances where a child is born late and they have to induce labor because that could obviously be harmful to the baby. But most people fall into that category. Other animals, it does tend to be associated with size of the creature because other animals have varying levels of how long they're pregnant for. So, for instance, let's see, mammal pregnancy length. We can get a general idea here. So, for instance, chipmunks, small creatures, right? 31 days. Cows, all the way from 279 to 292 days. It becomes substantially different. I think the longest gestation is a whale, if I had to remember correctly. No, elephants. Wow. Elephants can take quite a bit of time. It can take upwards to 510 to 730 days of gestation when it comes down to how long it takes for an elephant to be born. Whales are pretty up there too. But again, the idea is that size of the animal matters, right? If you look at this little chart down here, yeah, we're middle of the pack is a good word to use when it comes down to size of mammals. A lot of creatures that are much smaller than us physically cannot gestate a creature for that long. But a lot of creatures that are much larger than us gestate for much longer. So some anatomical changes that are going to occur to the female body. Enlargement of the uterus, that's obvious, right? As the embryo into the fetus starts to grow, of course needs space, so the uterus is going to enlarge. And as I mentioned in previous videos, as a uterus enlarges, it actually pushes some of the organs away. There's only so much space inside the body, right? So that does restrict how much size or how much the bladder can expand. That also restricts a bit of the large intestine and the rectum and the sigmoid colon. That also restricts a little bit upwards into the stomach. So overall, it does move things around. An accentuated lumbar curvature. So our spine naturally has curves. If we remember back in the skeletal system, it curves from the cervical to all the way to the lumbar, expected, right? Because of this growth, the lumbar region accentuates. So it's actually curving even more than normal. Again, not normally a big deal, but that's just part of the process of pregnancy. Relaxation of the pelvic ligaments and pubic symphysis due to production of relaxin, special hormone that's secreted. It just helps to relax these particular ligaments found near the pelvis so that you're not increasing the tension there unnecessarily so. So here's some physiological changes that occur as far as while a woman is pregnant. First off, with regards to the gastrointestinal, so the digestive system, the GI, as we learned in our previous unit. Morning sickness, that is super, super common, especially in the earliest days of pregnancy. Typically speaking, as you reach second and the third trimester, you're going to see less of this, is the hopes. But in the early first trimester, this is really an early indication of possible pregnancy. And the reason for that is elevated levels of progesterone. It makes it very difficult, just nausea overall. And you could be eating whatever your normal eating habits are. And unfortunately, it doesn't sit well with your stomach. Heartburn, as we mentioned, the uterus pushes up and away, kind of expanding its size. So the stomach gets a little crowded, causes more stomach acid to reach up into the esophagus, causing a little bit of heartburn. Constipation, as I mentioned, decline motility of the digestive tract. So all these things are being affected as the uterus expands substantially. Another thing to mention when we're on the topic of digestive, another classic symptom, I guess, if you want to call it that, relating to pregnancy and digestive system are these cravings. It's an odd thing. There isn't really a clear-cut answer as to why do pregnant women get these strange cravings. And that's not always the case. You can ask a lot of mothers, like, hey, when you were pregnant, did you crave anything crazy? And maybe they'll say, like, oh, yeah, like cheese fries. And that doesn't sound too out of the norm. But then there's other cases where some women craved foods that normally they would despise. So a lot of that is just honestly hormonal differences and obviously having to fuel new life. So it's just chaotic is the best word to use. But it's the whole reason why during that time period, you try to provide for that mother-to-be with as many resources as possible and then try to make them as relaxed as possible throughout all of this, which includes sometimes getting strange foods. On the urinary system, some changes that we observe. Again, this is kind of obvious as far as just thinking of how the uterus expands. Kidneys have additional burden and will produce more urine. And because the uterus is compressing the bladder, you can't store urine longer. So this is a two-sided punch in this case. The kidneys are being pressed on, so they make more urine, but the bladder can't expand to normal size, so you urinate more often. So unfortunate as far as one of the side effects that we observe. Another physiological change, respiratory system, again, because everything's kind of forcing its way through. The nasal mucosa becomes congested and swollen, so it's often to have a little bit more congestion during pregnancy. Interestingly enough, and kind of makes common sense if you think about it, vital capacity and respiratory rate increase. So while a woman is pregnant, she is having a higher vital capacity and a faster respiratory rate. And the simple reason for that is not only are you still nourishing your own blood cells with oxygen and getting rid of carbon dioxide, you're also now nourishing this new life. So that makes sense. Simple, right? You're breathing for two, just like you're eating for two. Cardiovascular system. The amount of water in the body rises. It is very common for pregnant women to start to have a little bit of swelling, especially like in the feet and hands, the extremities. So that does happen. Sometimes you'll see, like, for instance, ring size can increase by half size or even a full size in the instance of a woman being pregnant, just because the tissues are starting to swell due to the amount of water being retained. Blood volume increases substantially by 25 to 40%. Again, common sense, right? You're not only still nourishing yourself, but you're nourishing new life. Blood pressure and pulse increases. Again, common sense. And then a side effect that can occur sometimes in women are what's called varicose veins. They're also called spider veins. These are veins that can happen many times in the extremities, especially in the legs and around the quads and calf area. These are veins that just, because of the increased pressure, they kind of pop a little bit. They're not damaged. They're not harming you necessarily, although sometimes it could be harmful if it becomes a bigger issue. But more often than not, they just become more protruding, and you can physically see them more on the surface of the skin. There are procedures that can be done to help treat this if it is an issue that becomes serious enough. Okay, we're actually making good progress. I may make this video a little bit longer just to finish up because we're on 60 or 64. Let's talk about childbirth, or partition is the more technical name. I'm perfectly fine with childbirth. Labor, it is the series of events that expel the infant from the uterus. So when someone's in labor, it's when the baby's coming out, right? What are the initiation of labor? So what are the things that must happen? Estrogen levels have to rise, and they rise up substantially. Uterine contractions will begin. The placenta will release what's called prostaglandins, a special compound we don't have to worry too much about. We do need to know this because we've seen this before, so not a bad idea to remember this. Oxytocin. Hey, we've seen that hormone back in the endocrine system. It is released by the pituitary gland, and oxytocin is actually going to start the contractions of the uterus. And remember, this is a classic example of positive feedback. You're going to secrete oxytocin at substantially high levels and just more and more of it until the baby's born. That's the entire process of how this whole positive feedback system worked, if you remember back in the endocrine system. Combination of these hormones is going to produce contractions, as we mentioned earlier. So it is a combination of a couple things, but oxytocin is the major player here. Here we're just able to see the step-by-step process of what has to happen when a woman is in labor. Again, you can follow through this on your side, but hey, there's that positive feedback mechanism I was mentioning. Make sure you're aware of that, just so you know, especially if you're going to pursue this type of stuff in the future. You will learn more about this in other classes in college, guaranteed. As far as the stages of labor, pretty straightforward. Dilation. So when dilation occurs, the cervix expands. Remember, think of the eyes and how they dilate. They expand and open up with regards to light. Same thing can happen with the cervix. However, the cervix only dilates when the body's telling yourself it's time to get this thing out. It's time to get this moving, right? Uterine contractions will begin and increase, and then the amnion will rupture. So the amnion, if you remember, it's this fluid sac that contains that is surrounding the baby. That bursts. And when you hear in layman's terms, my water broke, that's what's breaking. The amnion ruptures and physically exits the body. It is not water. It is more of just a term used, but it is an amniotic fluid that is a see-through fluid. But yes, that physically exits the body, and that's an indication that dilation has begun, labor has begun. Got to get this going. Expulsion. Infant passes through the cervix and vagina. Again, normal deliveries head first. I talked about this in previous videos. There are instances where a baby can be expulsed feet first. If that happens, that is a very careful situation to be handling. It depends on how fast the baby moves out. It also depends on the angles of everything. Because again, in an instance where a baby is born or is birthing feet first, they call that a breech birth. The umbilical cord, which connects to the baby's stomach, the belly button region, can wrap around the baby's neck. And obviously, if that's occurring when the baby's starting to birth, that can choke the baby. So that may be a reason why they stop the normal birthing process and say, sorry, we have to do a C-section or a cesarean. A cesarean is a procedure that, like I said, in today's day and age, has minimal risk, but every single procedure has risk. It is something to be aware of. Sometimes a mother will choose to have a cesarean instead of just doing a vaginal birth. Other times, medical professionals have to do that to save the mother's life. There are instances where if the birthing has so many complications, it can put the mother's life at risk. So they give the mother medication. They slice into the abdomen region, open up the uterus, and they take the baby out that way. And that can severely reduce the risk of any issues going on or any problems of either affecting the baby or the mother for that matter. And then finally, after the baby's born, and this is assuming that the baby's born vaginally speaking through the birth canal, you have the placental stage. So again, the baby exits out, the umbilical cord is still connected, they cut the umbilical cord pretty quickly. The placenta will also expulse out too. And again, in most cases, especially in Western cultures, it's just going to be disposed of in a medical waste bag. So no problems there. And finally, here we just see the step-by-step process that we were observing, right? Dilation of the cervix, so the cervix starts to expand. The baby normally, with those contractions, it actually usually gets moved. So the uterus tries to move the baby in the direction so that the head is positioned first. Then expulsion, so it's just squeezing as much as possible. And then finally, after everything's said and done, the remnants of the umbilical cord, the placenta, all of that has to exit, so it will, naturally speaking. And that's about it. This was our last unit for the course. I'm glad that you guys were able to tune in for this stuff. We will have a test for this on Tuesday. No, on Wednesday. I am going to move that back a little bit. So I'll make an adjustment on all that just because of timing. So the plan is going to be this video will be releasing on Monday. Tuesday, we'll be doing our Kahoot, our review, and I'll post that in Classroom as usual. Wednesday will be our test. Thursday will be our short essay, and that's the last grade for the class and the quarter. So not too much left. We're almost done. All right, so thanks for tuning in, guys. I appreciate it. See you in the next one.